Have you ever looked down at your dinner plate and felt a sudden wave of fear? Not because the food looked bad, but because you weren't sure if it was quietly destroying your kidneys. That fear is real. I see it in my patients' eyes every week. Here's the truth. More than 37 million Americans are living with chronic kidney disease, and most don't even know it until it's too late. By the time creatinine climbs, the damage is already happening. Every wrong food choice can push you one step closer to dialysis. And what's one of the biggest fears I hear? Doctor, can I even eat meat anymore? Because the wrong kind of meat, prepared the wrong way, doesn't just harm your kidneys. It can speed up bone loss, raise your phosphorus, weaken your heart, and quietly rob you of years of health. But here's the twist. Meat itself is not the enemy. In fact, certain meats, eaten the right way, can lower creatinine, protect your kidneys, and rebuild your strength. No miracle pills, no gimmicks, just food. That's what this video is all about. I'm going to reveal the 5 safest, most kidney-friendly meats you can eat, even if you're in stage 3, stage 4, or on dialysis. You'll also discover one simple bedtime habit that helps boost kidney circulation naturally, something most doctors don't even mention. Every recommendation I share comes from real science and real patients whose lab numbers turned around with these exact changes. My name is Dr. Mattheus, and after 15 years helping kidney patients fight back, I created this channel, Kidney Health 365, to give you clear, science-backed solutions without fear or confusion. Make sure you hit subscribe and turn on the bell so you don't miss the tools that could change your health. And I want you to stay with me until we get to the section on turkey breast, because that's where I'll reveal a patient story that might change the way you look at protein forever. So let's get started, because the very first meat on our list may look plain and ordinary on the plate, but for your kidneys, it could mean the difference between slow decline and long-term stability. One of the most powerful yet gentle proteins for your kidneys is fresh white fish. It may look simple on the plate, but for kidney patients, it delivers clean protein without the hidden damage. Eating white fish can lower phosphorus, reduce itching, and support stable creatinine levels. A 3-ounce serving of cod, haddock, tilapia, or sole gives you around 20 grams of high-quality protein, but very little phosphorus, only about 150 to 200 milligrams. And most of it is the organic kind, which your body doesn't fully absorb, unlike the dangerous inorganic phosphorus in processed meats. That means less stress on your kidneys. White fish is also low in potassium, usually 200 to 250 milligrams, keeping your heart safe from dangerous spikes. Add to that its low purine content, and you've got a protein that won't trigger gout or raise uric acid levels. On top of that, it carries heart-friendly omega-3s, vitamin B12, and selenium to fight inflammation and protect your vessels. But let me be clear, white fish isn't perfect for everyone. If it's fried, salted, or breaded, you lose the benefits and add stress to your kidneys. And for those with seafood allergies, this option is off the table. Always talk with your doctor before making big changes. The best way to enjoy it? Bake, grill, or steam. Keep it simple. Use lemon, garlic, or fresh herbs instead of heavy sauces or seasoning packets that often hide phosphates. Aim for 2 to 3 servings a week, depending on your labs and your doctor's advice. When shopping, look for wild-caught options if possible, and avoid pre-marinated or frozen fish with additives. Want variety? Try a light fish soup with fresh vegetables. That way you get hydration, gentle protein, and flavor without the extra salt. Or prepare a fish salad with olive oil and lemon. Both options are kidney-friendly, refreshing, and easy to digest. If you're on phosphate binders or blood-thinning medication, check with your care team before increasing fish in your diet. Even healthy proteins need to fit into your overall treatment plan. If you've tried white fish before, I'd love to hear. Did you feel a difference in your energy or lab results? Share your experience in the comments. Now, While white fish is the quiet healer, there's another protein that acts as a steady lifeline, something most of us already eat, but often prepare the wrong way. Let's talk about skinless chicken breast. If white fish is the quiet healer, then skinless chicken breast is the steady lifeline for kidney patients. It's simple, familiar, and often underestimated, yet it provides one of the cleanest sources of protein your body can actually use without leaving behind harmful waste. For someone living with kidney disease, every bite counts, and chicken breast makes those bites safer. A 3-ounce serving of skinless, boneless chicken breast delivers about 26 grams of high-quality protein that your body absorbs efficiently. This helps maintain muscle, support your immune system, and boost your energy without overloading your kidneys. Even better, it contains only around 190 milligrams of phosphorus per serving, and most of that is organic, not the dangerous inorganic kind found in processed chicken nuggets or deli meats. That makes a huge difference for your bones and blood vessels, reducing the risk of calcification and painful complications. Chicken breast is also low in potassium, around 220 to 250 milligrams, making it safe for most kidney patients. With less than 1 gram of saturated fat, it protects your heart, lowers LDL cholesterol, and helps manage blood pressure, all critical for people with kidney disease who face higher cardiovascular risk. Of course, there are risks. The benefits disappear if chicken is fried, heavily seasoned, or processed. Store-bought marinades and frozen patties often hide sodium and phosphate additives that can quietly harm your kidneys, and anyone with gout or joint issues should still keep portions moderate, even though chicken is lower in purines than red meat. To get the best results, choose fresh, skinless chicken breast. Bake it, grill it, or steam it with natural flavorings like lemon, garlic, ginger, or rosemary instead of salty sauces. Aim for 2 to 3 servings a week, depending on your personal diet plan and lab results. When shopping, look for labels that say, "No added solution," or "No preservatives," because those hidden additives can be dangerous. Want to keep it interesting? Try a simple chicken and vegetable soup with carrots and zucchini, hydrating, filling, and kidney-friendly. Or prepare a cold chicken salad with olive oil, cucumber, and a dash of fresh herbs. Both options keep the protein clean and easy to digest while giving you variety at the table. If you're on phosphate binders or managing bone health issues, always check with your doctor or dietitian before increasing your chicken intake. Even the healthiest protein needs to fit your individual care plan. Now, while chicken breast offers steady strength, there's another option that often surprises people. It's not just holiday food. It's actually one of the most underrated kidney-safe proteins you can add to your diet. Let's take a closer look at fresh turkey breast. Back in the introduction, I told you there was a meat most people think of only during the holidays, but for kidney patients, it can be a true hidden gem. That meat is fresh turkey breast. It's often overlooked, but when prepared the right way, it can be just as healing as fish or chicken, and sometimes even more powerful. A simple 3-ounce serving of skinless turkey breast gives you about 25 grams of high-quality protein, clean, efficient fuel that helps your body repair tissue, maintain strength, and keep energy levels steady. Like chicken, it's low in phosphorus, around 190 to 200 milligrams per serving, and it's mostly organic phosphorus that's less absorbed by the body. That means less burden on your kidneys and less risk of dangerous calcium deposits in your heart and blood vessels. Its potassium content stays in the safe zone too, about 250 milligrams per serving, making it manageable for most patients with portion control. But where turkey really shines is in its micronutrient profile. It's rich in niacin and vitamin B6, which support blood vessel health, reduce nerve irritation, and help fight the brain fog so many kidney patients struggle with. It also contains selenium, a nutrient that boosts glutathione, your body's master antioxidant, helping to reduce inflammation inside the kidneys. And let's not forget the iron, which, when paired with vitamin C-rich foods like red bell pepper or a squeeze of lemon, can make a big difference in fighting anemia and fatigue. Of course, there are risks if you pick the wrong type. Deli turkey slices, smoked or cured turkey, and pre-packaged cuts are often loaded with sodium, nitrates, and phosphate additives Exactly what kidney patients must avoid. That's why the rule is simple. Always choose raw, skinless turkey breast with no preservatives. For the best results, cook it gently. Bake, grill, or roast with natural herbs like thyme, rosemary, or garlic. Avoid brining or heavy seasoning. Aim for 2 to 3 servings a week, rotating it with fish and chicken for balance. If you want variety, try a warm turkey and vegetable stir-fry with bell peppers and zucchini, or prepare a refreshing turkey salad with cucumber and olive oil. Both give you healing protein and clean, simple meals. One more precaution. If you're on iron supplements, talk to your doctor before eating turkey regularly, since too much iron can cause complications. Always make sure your protein choices fit into your overall care plan. I've seen patients regain strength, reduce creatinine, and feel more energized just by swapping processed meats for fresh turkey breast. It's one of those simple changes that deliver real results without pills or fads. Now, while turkey breast is often the holiday hero, our next protein may surprise you even more. Many people with kidney disease believe they have to avoid it completely, but when chosen wisely, it can actually help rebuild strength and stability. Let's talk about lean ground beef. For many kidney patients, the idea of eating beef feels frightening. Isn't it too heavy? Too much for my kidneys? I hear this all the time, but the truth is, when chosen and prepared the right way, lean ground beef can be not just safe, but deeply nourishing. A 3-ounce serving of lean ground beef, 90% lean or higher, delivers about 22 grams of high-quality protein. That's the kind of protein your body absorbs and uses to rebuild muscle, support your immune system, and maintain energy without leaving behind excess waste. And here's the key difference. Compared to fatty cuts, lean ground beef contains less saturated fat, around 3 grams per serving, helping you protect your heart while still enjoying the benefits of red meat. Nutritionally, lean ground beef is rich in iron, zinc, and vitamin B12. Iron supports red blood cell production and helps prevent anemia, a common struggle for kidney patients. Zinc and B12 are essential for nerve health, mental clarity, and overall energy. That means fewer days of fatigue, fewer dizzy spells, and more strength to keep doing the activities you love. But let's be clear, there are risks if you pick the wrong type. Regular ground beef, fatty cuts, or fast food burgers are loaded with saturated fat, sodium, and phosphate additives. Those can increase cholesterol, strain your kidneys, and lead to faster decline. That's why it's important to choose 90% or 93% lean ground beef and avoid pre-seasoned or frozen options that hide dangerous preservatives. To make it work for you, aim for just 1 or 2 servings per week. Bake or grill it instead of frying. Keep seasonings clean. Garlic, onions, black pepper, or fresh herbs work beautifully without adding sodium. And pair your meal with kidney-friendly sides like zucchini, green beans, or a light cucumber salad to balance the dish. If you want a little variety, try turkey beef patties for a lighter texture, or make a kidney-friendly beef and vegetable soup with carrots and cabbage. Both variations give you flavor and comfort while still protecting your kidneys. One important precaution: if you have high cholesterol or heart disease, talk with your doctor before adding beef regularly, even the lean kind. Balance is always the key. I've seen patients regain energy and strength by introducing lean ground beef in moderation, especially those who were feeling weak from cutting out red meat completely. It's not about saying never. It's about saying wise choices. So, while lean beef shows us that even red meat can play a role in kidney health when chosen carefully, there's another option many people forget about. It's mild, lean, and incredibly versatile, yet often overlooked on the kidney diet. Let's move on to meat number 5, lean pork tenderloin, a protein that just might surprise you. If beef feels too heavy and chicken too plain, there's one lean option that many kidney patients overlook: pork tenderloin. Unlike the fatty pork cuts you find in ribs, bacon, or sausage, tenderloin is one of the leanest cuts of pork, making it a surprisingly kidney-friendly choice when prepared the right way. A 3-ounce serving of pork tenderloin delivers about 22 grams of high-quality protein, nearly identical to chicken breast, but with a slightly richer flavor. And here's the good news. It contains just 2 to 3 grams of fat, with very little saturated fat. That means you're getting the strength-building protein you need without overloading your heart or kidneys with excess fat. Nutritionally, pork tenderloin is a powerhouse. It's packed with thiamine, vitamin B1, which supports nerve health and energy metabolism, 2 areas that often suffer when kidney disease progresses. You'll also find vitamin B6, selenium, zinc, and iron, all crucial for fighting fatigue, protecting immune function, and keeping your red blood cells strong. But let me be clear, not all pork is safe. Processed pork products like ham, bacon, hot dogs, and sausages are loaded with sodium, nitrates, and phosphate additives. Those can raise blood pressure, worsen fluid retention, and drive your creatinine higher. That's why the key is to stick with fresh, unprocessed pork tenderloin only. For best results, enjoy 1 or 2 servings per week. Roast or grill it with simple seasonings. Think rosemary, garlic, or lemon juice. Avoid heavy sauces, marinades, or salty rubs. Pork tenderloin is naturally tender, so it doesn't need much to shine. Pair it with roasted asparagus or sautéed zucchini for a balanced, kidney-friendly meal. Want to switch it up? Slice tenderloin thin and stir-fry with bell peppers and cabbage for a colorful, low-sodium dish. Or bake medallions with a touch of apple slices for natural sweetness without added sugar. These variations keep your meals exciting and support your kidneys at the same time. A word of caution. If you're on a strict low-protein diet prescribed by your doctor, make sure to check portion sizes before adding pork tenderloin regularly. And always choose fresh over frozen, because packaged pork may contain hidden sodium. Many of my patients have told me that bringing pork tenderloin back into their diets gave them variety and satisfaction, without the guilt or kidney stress they once feared. It's proof that eating for kidney health doesn't have to be bland or joyless. And speaking of joy, let me share something outside of food that makes a huge difference. It's not on your plate. It happens in the quiet moments before bed. A simple bedtime habit that improves kidney circulation, calms your body, and supports healing while you sleep. Let's talk about the bonus. Bedtime habit next. Now, let's step away from the dinner table for a moment, because protecting your kidneys isn't just about what you eat. It's also about how you care for your body when it rests. One of the simplest, most powerful habits I teach my patients is a short routine before bed, gentle stretching combined with deep breathing. It may sound almost too simple, but don't underestimate it. When your kidneys are under stress, they don't just need nutrients, they need circulation. Steady blood flow and oxygen delivered to those tiny filtering units working all night long. And that's exactly what this habit provides. Just 5 minutes of light stretching, like a seated forward fold or a gentle spinal twist, helps open up blood flow to your lower back and kidney area. Pair that with 2 or 3 minutes of slow diaphragmatic breathing, inhaling deeply through your nose, letting your belly rise and exhaling slowly, and you activate your body's parasympathetic system. That's your natural rest and repair mode. When that system turns on, inflammation drops, blood pressure steadies, and your kidneys get the break they desperately need. Research, including studies from the Cleveland Clinic, has shown that even short sessions of yoga or breath work can lower stress hormones and reduce markers of kidney inflammation. Best of all, this habit costs nothing. No pills, no machines, no appointments. Just you, your breath, and a few quiet minutes before sleep. And my patients who practice it often tell me they fall asleep easier, wake up less during the night, and feel calmer in the morning. That's healing you can feel right away. So remember this. Protecting your kidneys isn't only about the food you choose. It's about the choices you make throughout the day, and especially at night. Because nighttime is when your body does its deepest healing. And speaking of healing, we've now covered the 5 safest meats you can enjoy, and a simple bedtime practice to protect your kidneys. But how do we put all of this together? How do we stay consistent, avoid hidden dangers, and truly take back control? Let's bring it all home in the conclusion. We've covered a lot today, from the clean power of white fish to the steady strength of chicken breast, the healing boost of turkey, and even the leaner choices like ground beef and pork tenderloin. And we ended with one simple bedtime habit that costs nothing but can make a real difference. The truth is simple. The right proteins, prepared the right way, can protect your kidneys, lower creatinine, and restore energy. But here's what you can't forget. Kidney problems progress quietly. By the time symptoms show, the damage is often already advanced. That's why every meal, every choice, matters. Starting today could mean slowing down kidney decline and avoiding dialysis tomorrow. And I want you to know, you can do this. You don't need to be perfect. You just need to make small, consistent changes. One better meal, one gentle stretch before bed, one smarter choice at the grocery store. That's how healing begins. So here's my challenge to you. This week, swap one processed meat for a fresh, kidney-safe option. Or take 5 minutes before bed to stretch and breathe. Just start with one step and see how your body responds. Of course, remember, this video is for educational purposes only. It's not medical advice, and it doesn't replace the guidance of your doctor. Always talk with your healthcare provider before making major changes to your diet or lifestyle. And if you found this video helpful, subscribe to Kidney Health 365, hit the notification bell, and share it with someone you love who might be struggling in silence. In our next video, we'll dive into the 3 vitamins that protect your kidneys, and the 3 you should absolutely avoid. You won't want to miss that.